If you have long COVID, long haulers syndrome, or post-acute COVID syndrome, chances are that you have adrenal fatigue underlying that. I'm Dr. Andrew Neville. I'm going to tell you why. Long COVID is a situation that develops no matter the severity of the condition, and we have the research that shows that. It's not severe people that develop long COVID or people that have bad infections. It's just about anybody. In fact, estimated 15 to 30% of people who get exposed to COVID develop long COVID symptoms, right? And it's just basically prolonged symptoms, right? Prolonged illness. It could last months. It could last many months even, and sometimes pretty debilitating. The question I always ask is why? What's the difference? Like, why does that happen? And there's a bunch of different theories that people talk about. Comorbidities, they talk about severity of infection, maybe the virus is still there, right? What is it? Well, we've ruled out kind of a bunch of those different things. What we do know a lot about, though, from the history is something called post-viral fatigue, right? Or post-viral syndrome, which can develop when you have just about any infection, right? Whether that's, so one of the classics is Epstein-Barr, right? Epstein-Barr virus is a herpes family virus. It's ubiquitous. Everybody gets infected with Epstein-Barr. Most people don't have a problem with it, right? Some people get mono, but then they clear it, not a big deal. But there are some people where Epstein-Barr is prolonged, it's severe, and sometimes it reactivates. So the question is why, right? If a virus is reactivating, or if a virus, you can't clear that virus over time as effectively as, say, your neighbor, right? Same virus. What's the difference? Well, the variable is you, right? The variable was me. Right? So what does that mean? That means my immune system is not strong enough, right, to either fully eradicate that infection or, in the case of like Epstein-Barr, to keep that infection dormant, right, because those are herpes family viruses. They never leave us and all that. SARS-CoV-2, that's different, right? The COVID-19 virus, that's different. You'll fully eradicate that. So the issue is, well, if my immune system is weaker and it can't fully eradicate that, again, why? Well, the number one controller of your immune system and the strength and the ability of your immune system to fight is actually your stress physiology. We know very well, it's well documented that stress physiology, right, when our body is in fight or flight and we're releasing excess stress hormone, that stress hormone goes to the immune system and causes a very predictable, well supported in the research shift, which suppresses our ability of this one part of our immune system to fight infection and to clear infection, to fully eradicate infection. We know that that happens, right? So in adrenal fatigue, right, which is a very poorly understood condition, unfortunately, but with adrenal fatigue, which is basically a bit of a genetic predisposition and enough chronic stress over time of any kind to overwhelm those genetics, our body kind of gets stuck in fight or flight. When that happens, that stress hormone suppresses a bunch of organs, which aren't really important if you're like fighting a tiger or something, right? One of those organ systems is your immune system. So one of the main underlying players here with regard to long COVID, long haulers, post-acute viral or COVID syndrome is going to be the fact that you might have adrenal fatigue, which is setting you up for that problem. And the way to tell is look at the symptoms of adrenal fatigue. And you can go, we've got a website that has even a symptom assessment questionnaire, right? But look at the symptoms that are associated with adrenal fatigue prior to you getting COVID, whether that's chronic fatigue or pain or maybe weight, some insomnia, anxiety, depression, maybe some blood sugar, blood pressure issues, some other things, right? And if any of those symptoms are present prior to developing long COVID, chances are you've got an adrenal fatigue issue. And when you fix that, that's when you can shift this physiology, stop suppressing your immune system, let your immune system kick in on its own, and it can finally fully eradicate that infection. So then you can kind of get better incrementally, get on with your life, and not have to worry about this stuff anymore. Good luck.